Thank you all for joining today's CSCRS Research to Practice Bytes webinar on reframing crash reporting in news media. We're joined today by Elyse Keefe, who is a road safety project coordinator at UNC's Injury Prevention Research Center. So we look forward to hearing from Elyse shortly. Before we do that, if you aren't already familiar with the Collaborative Sciences Center for Road Safety, or CSCRS, our mission is to accelerate progress in reducing transportation-related injuries and fatalities by utilizing a systems approach to bring perspectives from planning, engineering, public health, data science, and robotics, and a number of other fields to road safety. We're one of two national centers with a designated focus on transportation safety. We bring together staff, faculty, and students from different UNC departments, as well as those at our partner institutions that you see here on the slide. So we're glad you're here to join us for this Practice to Bytes webinar session. We're going to give a bit of housekeeping before we get started. Participants, you're all muted during the session, but you do have the ability to communicate with us. You have a Q&A, question and answer box that we hope you'll send us your questions as you have them throughout the webinar, and we've saved some time at the end for discussion. The session today is being recorded, and CSCRS will make the recording and the slides available a little bit later. And just one tip, if you want to optimize your view, you can use the speaker view option at the top of your Zoom screen, so you can see both the presenter and the slides at the same time. I don't have anything else, so please let's turn this over to Elyse Keefe. Elyse, if you want to go ahead and get started, we'll look forward to your material.
All right. Thank you so much, Dan. Can everyone see my screen?
Yes.
Okay. Perfect. Yeah, well, thank you so much for having me. Thanks to everyone who's able to join today. As Dan said, my name is Elyse Keefe, and I'm the Road Safety Project Coordinator at the UNC Injury Prevention Research Center. I'm just going to start off with an acknowledgement of the project team. So my co-PI, Stephen Heine, as well as Seth LaJeunesse, who led the initial project on this topic at UNC, as well as Sheng Ma and Cesar Reyes, who were also instrumental on this project. So as everyone here is probably aware, road injuries and fatalities in the US are a public health crisis. So we are losing over 40,000 people a year on our transportation network. And that number has been growing in recent years, especially since the beginning of the pandemic in 2020. And then further, when measured up against other risks, motor vehicle crashes remain a leading cause of death, especially for children and young adults. I think it was this week or last, Secretary Buttigieg actually pointed out this is at the same level as firearm deaths for young people. Despite this crisis and attempts by states and communities to try to bring those numbers down, most recently through initiatives like Vision Zero, road trauma is not exactly what you'd call a hot topic. So kind of going back to the example of firearm deaths or even opioid overdoses, it's really just not garnered that widespread support in the US as a problem that needs to be prioritized and addressed. So I understand there might be some media folks on the call today or others who might not be familiar with the SAFE system approach. So I'm just going to quickly describe this framework. It's shown in the image here on this slide. So the SAFE system approach is a newer framework that's being applied in the US and represents a paradigm shift in how we think about and how we attempt to address road deaths. So this is usually most visible through Vision Zero initiatives. Again, so some people might be more familiar with that, which should be using a SAFE systems or SAFE system framework. So in the center, you can see the goals are, safer vehicles, safer speeds, safer roads, et cetera. But I would argue the real change in thinking comes from the principles that you kind of see going around that circle. So things like death and serious injuries are unacceptable. Humans make mistakes, or humans are fallible. Humans are vulnerable, and so on. So the key principle that this project is kind of based around is that responsibility is shared principle. So that means that we are trying to move away from this idea that individuals and road users themselves are primarily responsible for their safety as they navigate our transportation network, and instead asserts that those of us that design or have the ability to influence the transportation system through policies or other mechanisms also need to acknowledge our responsibility and potential for preventing road deaths. And this includes news media. So news media have a really important role to inform the public about this problem. So the scale and the prevalence of it, the populations that are most affected by road trauma, because there are disparities there, for example, and they have a role to inform the public about what's being done or what's not being done to address it. And finally, to also tell some of these human stories behind these tragedies to really convey the trauma and the reverberations of these serious and violent crashes on both the victims when they do survive, and also on the families and friends and loved ones who are left behind when they don't. So all stories have a particular framing. So there's lots of ways to tell the same story. All of them can be true, but depending how a story is told, those takeaway messages for the audience might differ. So this is not necessarily bad, as long as no one's intending to mislead their audience or something. Usually it's just kind of a reality, right? You can't include every single detail in a story, so inevitably certain aspects or events become the focus while other details are left out. So frames are therefore what then guide audiences to create meaning and understand events or phenomena in a particular way. So one important distinction is that between what's called episodic framing and thematic framing. So in the context of road trauma, episodic framing is going to treat a road crash as an isolated incident. So it can have all the basic facts. So, when the crash happened, where, types of vehicles, road users involved, extent of injuries, any charges filed. Whereas a thematic frame is going to go beyond this to actually place that particular crash within a larger context or narrative about road injury. And this can be done in lots of different ways. So we'll talk about some of those. And so framing is essentially a key way that news media they're currently already, because frames are always there, right? So it's already influencing public opinion related to road trauma. And there's a lot of potential for improving that framing, especially related to moving away from that episodic framing to the more thematic framing to increase awareness of this public health crisis and increasing that knowledge about ways to prevent those more serious crashes. So some helpful background. I'm just going to quickly summarize the first iteration of this project led by Seth Lajeunesse and Lucinda Austin. There is a previous webinar on this work, so definitely go look that up if you're interested in this project. So the team explored road injury narratives by analyzing over 1,000 Facebook posts from the most popular TV stations across 18 different regions in the US. Half actually had Vision Zero initiatives and the other half did not. And so, So very importantly, they found that over a third of all posts actually focused or framed the crash stories around driver delay. So essentially, someone in our community was killed on our roadway and now you're going to be late to work. And so that was over a third of the post had that sort of framing. And then the next most common frame was that of a victim narrative. So some type of human interest story focusing on the victim of a crash. But that was only about 12% of the post. Going back to that episodic versus thematic framing question, this study found that fewer than 8% of the stories included any type of thematic frame. So any mention of kind of environmental factors like lack of street lighting, crosswalks, or any larger trends. So any like history of crashes in that area. Let's see. So this means that most of the posts focused on the actions and circumstances related to the people involved. So again, that kind of focus on the individuals And that particular crash, it kind of primes us to blame the victims of that crash. And there were also some kind of interesting differences between the stories that came out of the Vision Zero communities. So they were less likely to use the term accident, more likely to use collision or crash. And they were less likely to focus on those road users, on people walking, on bikes, on motorcycles. And they were 2.5 times more likely to quote an elected official in the post. And then finally, fewer than 2% of the stories had any quote or perspective from a road safety professional. And so that is planners, engineers, safety advocates, or public health professionals combined. So the final outcome of that project was the development of the media framing guide for road safety professionals. And so that brings us to the current project that I'd like to share more about today. And so this aimed to update and enhance that guidance by speaking with two of the main stakeholder groups. Number one, the road safety and public health professionals, and secondly, to journalists. So we conducted a focus group with each of those two sectors to learn more about their relationships and communication between the two groups, and identify any other barriers to changing the framing of crash reporting. So we also asked the road safety professionals to review and provide some feedback on the guide itself, since they are the target audience of that resource. So some key findings from those focus groups. First, there were definitely a number of barriers that exist for those two groups, essentially just to talk to one another. So on the journalism side, there's often this time pressure for related to crash reporting. So they're trying to get stories out, trying to keep the public informed, and it's pretty easy to get enough verified details from law enforcement to get that info out and keep the public informed. Additionally, there's a little bit more turnover when it comes to the journalists that tend to write the crash stories. They're most often the beat reporters. They're covering lots of different topics, very busy, and a little bit more turnover in those positions. So all of that together kind of makes it pretty difficult to form a relationship where like a road safety professional, public health professional becomes their kind of go-to source on a story. And then on the other side of things, particularly road safety professionals that work in public agencies, they might have a public information officer, and that person's kind of supposed to be the designated spokesperson. So all communication, media requests go through that person. And then also some had some negative experiences with journalists or interviews in the past. Maybe they felt put on the defensive a little bit and things like that. And then finally, we did get some feedback from our target audience, road safety professionals, on the need for some simpler language in the guide and more examples of the framework kind of in action that was proposed in the guide. So taken together, implications for both of these projects. Number one, that initial analysis confirmed that, crash reporting tends to lack that context and instead focuses on the people involved and not so much the far-reaching long-term effects that these crashes are having on the victims, their loved ones, the community at large. And that framing prevents audiences from considering, effective solutions, creating that urgency to address the problem. Secondly, transportation public health professionals, they were not commonly cited at all. So they really need to enter the conversation. They're the ones that have that knowledge to provide that context about crash patterns, environmental risk factors, effective solutions and interventions and things like that. And then finally, based on our focus groups, we found there were some barriers to communication between the two groups. And so there was a need for a straightforward framework and some more tangible guidance about facilitating those conversations. So the result of this is a guide for road safety professionals. to provide a new framework to change that conversation, some updated guidance. And so we have an updated version with some more simplified language, shareable infographics, and some new strategies to communicate more often and more effectively with journalists. I'm sure we can link that in the chat. So we proposed what we call a four-frame approach. And so the first step in that is to choose a target message to communicate. And ideally, that is something that should align or emphasize something from the safe system approach. So something like just the idea that road deaths are preventable. And so we provide a list of those that you can see here. Some other ones, the importance of speed, human vulnerability, and things like that. So, having one central message, it's kind of just best practice for talking to the media. It helps you stay on point. It helps for communicating about a really complex problem like road safety. You're probably just going to get that one soundbite. You're not going to be able to convey all of this. So just picking one or just a few key takeaways and continuing to focus on those, it's going to help your audience also understand better and start to expand their thinking about road safety and the possibilities with regards to prevention. Next, if we're going to create any urgency around this issue, the public really has to begin to grasp the true human toll of these serious crashes. So it's really important to appeal to people's concern for others that most all of us do have. So acknowledging first that this was a life or lives lost, and that many people are affected by this. So family and friends, of course, but as a community, these types of events, they really affect everyone. And then number three, kind of what I've been saying the whole time. So road safety professionals can provide that context, right? That thematic framing. So immediately following a crash, you probably don't have the details of the investigation, all the circumstances, but none of that matters because you are able to speak to the local crash trends, the problem areas. Road safety professionals can provide insights about the types of intersections and roadways that are typically the most dangerous, and speak to things like the role of speed, how that's going to affect the severity of a crash, a driver's ability to react in time, and so on. So yeah, this type of framing is going to actually prime people, instead of blaming the victims, to be more interested and open to effective solutions and kind of those more upstream systems level solutions. Number four, and the final step to the approach is to then know what efforts are underway to address road safety locally. So, the public's often unaware of ongoing projects. Maybe they've seen them, gotten stuck in some construction traffic, but maybe they haven't actually connected them with efforts to improve safety. Road diets are a good example. Sometimes the conversation locally on that is going to be on driver delay or an us versus them with the addition of a bike lane. So this is a really good opportunity to try to bring that focus back to safety, provide information about proven safety benefits for all road users with that type of infrastructure change. And then ideally, within your limitations of what you can say, can also include some sort of call to action that goes beyond, be aware, drive safely, and those kind of individualized messages out there, but trying to think of ways that can actually empower audiences to be part of the solution. So again, based on the feedback we got from the focus groups, decided to give some examples of what statements might look like following a crash that follows this four-frame approach. And I think I'm going to skip this because I'm a little behind on time, but that's an example focused on speed. And then we included some strategies for Also increasing that communication and interface with journalists. So making yourself a resource, letting your PIO or communications team know that you're willing to make a statement. And don't wait for media to come to you. So make your own content. Use events or infrastructure projects, holiday travel to share press releases, pitch stories. And number 3, make a plan. So I think at the very least, just, put communications on your meeting agendas. Make sure that you're touching base as a group about, anything that might need to be communicated. And then maybe in the long term, you can actually set up a more formal procedure. And then finally, following the focus groups, we did include some tips for communicating better with journalists. So number 1, keep it simple. That's kind of reiterating step 1 of choosing your target message. Number 2, I mentioned before, you might not be able to speak to the specifics of a crash, but that's not your expertise, right? So just remind yourself, that's not your job. You're an expert on big picture of road injury in your community. Again, the risk factors and trends and ongoing projects. So speak about what you know. Number 3 is to confront bias when you can, sometimes called windshield bias. This tendency to victim blame is pretty common for lots of psychological, cultural reasons. So whenever it's appropriate and you're able to do it tactfully, attempt to draw attention to some more upstream contextual factors that move away from that victim blaming kind of attention. And 4th, it can also feel kind of, it's easy to get defensive, when you're being confronted with not having done something, full well that you're not the reason something wasn't done. So instead of kind of passing that blame, kind of check yourself emotionally and look to share a more empowering message by doing some active listening. So acknowledge the concern, assume best intentions, share what is being done, if there's anything, and then, try to suggest some ways for people to engage more effectively. So this is kind of our 1-page shareable infographic. Tries to summarize all those key points, key takeaways. And in sum, I think, many people are aware that, many aspects of road trauma in the US are not really technical problems, but are more social and political problems. So there's just not going to be much movement to truly address road trauma without some more widespread public calls for action and accountability. So we hope this guidance can push that conversation a bit. And then finally, we need a new story. So we need to hear about the lives lost and the reverberations of those losses to our communities. We need the public to be more informed about these system level factors that lead to these crashes, instead of empty appeals to pay attention and drive sober and so forth. So with that, thank you very much, and look forward to your questions.
Thanks, Elyse. Really appreciate that. And if folks didn't get a chance to see that previous webinar or read the report and the guide that Elyse talked about, we will be providing access to that information in the follow-up email. So stay tuned for that. You'll be able to find it all. We got a lot of good questions, so let me just roll through some of them. One person early on, where you're talking about some of the different ways that these stories are framed, they brought up this idea of the innocent victim frame that maybe implies, as you tell a story about a person who was involved in the crash, that maybe you can frame their story as being maybe more or less innocent than another person. And they offer this example of, say, a child being struck by a car versus an adult walking home from a bar, and telling some of this backstory may inadvertently communicate to readers about what the values of these two people, or whether they were innocent or not in the crash. I wonder if you could speak about that and maybe how that idea of this innocent victim frame maybe fits in with some of the work that you've done on this project.
Yeah, that is
it's a tough one. I know.
That is a tough one.
Wasn't sure how quite to ask it.
I know. Yeah, I'm trying to kind of pull out exactly which piece to answer, because I feel like there's a lot in that. So the idea that yeah, I mean, I think like I said about framing, I think, you know, we pull our biases into this for sure. And so there's certainly populations that in general people feel more sympathetic to than others. And I think in the original research that Seth's team did, they did find that there was much more engagement when the victim of a crash was a child. And there's definitely this perception that yeah, children are much more innocent victims than someone who's intoxicated. Yeah, I think hopefully, you know, focusing on children in crashes is, you know, would actually be able to spur action. You know, it's not necessarily a bad thing that people view them as vulnerable. And then so I would say that that more attention probably does need to be paid to the populations that the people are less sympathetic to. So, you know, when crashes happen at 4 in the morning, and then it's included somehow in the story that the person was intoxicated, and pushing back against that a little bit, and questioning if that's a detail that really needs to be included, if that we need to question, does that deserve of you know, being involved in a fatal crash?
Yeah, no, I think
across the street.
it does seem like there's a balance there between like really telling a story to humanize those involved versus sharing that information that may be speculative and may result in ideas or impressions that don't match reality, for example. So that's a really good question. Thank you for asking that one, though. There were some more questions about children specifically, and whether the guide and some of the work that you've done gets into looking how these crashes involving children are framed, because it does seem like looking at child safety and child travel in general is a really useful way to like a foot in the door for Vision Zero and safe system work, and it's used a lot. But I wonder if this project tackled that issue specifically.
Yeah, I definitely agree with that. This project did not tackle that specifically. I don't think there's anything in the guidance distinguishing by age or anything like that. I think we mentioned a little bit about some other racial disparities among victims of road trauma. And yeah, I think that'd be a great next direction, would be to offer up some guidance about that.
Yeah. There are several questions about the kind of that detailed language framing of the example given here in this question was a car jumped the curb, changing that to the driver drove over the curb. Is that one, would you say that's one of the central takeaways of for maybe a journalist of thinking about that exact kind of reframing of those statements could be a really powerful way to make this message land?
Yeah, I feel like I hear that a lot, and I'd have to ask Seth Lajeunesse a little bit about that first project, because I was surprised in reading their initial report that actually it was something like 97%. It was 90-something% of those stories that they reviewed actually did use active language. So yeah, I think that should maybe be looked at a little bit more, maybe breaking that down a little bit. So when is active language being used? Does that differ if, you know, it's a pedestrian involved or bicyclist involved crash?
Cool. Okay. And then I guess a final wrap-up question, this one came up a couple of times, is what would you, after kind of doing this work and kind of seeing what's unfolded with this project, how valuable would it be for agencies to begin considering hiring and training those within their departments, maybe the transportation departments or public health departments, to specifically be trained on and engage with media as part of that work? Could that be a role that Vision Zero communities and safe system agencies that pursuing that framework should invest in or consider?
Yeah, I think absolutely. I think that communications is a huge opportunity because I think there's a big disconnect between what's being done within agencies, within these Vision Zero communities and so forth, and then what the public is getting. I think there's lots of ways to do that. Certainly hiring someone that knows what they're doing within is great. I think there's also lots of opportunities through community engagement to do that as well. Some more informal communication avenues. So looking at who in the community would be most affected by safer transportation options, and really partnering with them and connecting to some other communities.
Great, perfect. Thank you so much. I have to cut things off because we are just 1 minute over time. I apologize, everyone, for that. I did want to share before you go, as you're going out the door, we do have a webinar coming up next month, February 22nd. Akshams Nichols, graduate student at UC Berkeley, will be talking about peer influence and the perceptions of safety. So hope you'll come back and join us for that session. I just want to say thank you again to Elyse Keefe for presenting today. Thanks to you all for joining us, and we look forward to seeing you next time. Thanks, everyone.